So from the name itself you can say it is child health emergencies, first aid, then poisoning, foreign bodies, hemorrhage, drowning and burns. So I'll see if I can complete it in this class, or I will have to continue in the next class. Okay. So what is an emergency? What is an emergency? All of you understand, right? So emergency can be defined as a condition that threatens the life of an infant, child, teen or young adult, thus requires medical attention. That means emergency medical attention is required. Okay. And then it can be caused, why an emergency will occur? It may be caused because of an illness, because of something that the child has eaten, or an injury, a foreign object, or a poison. Okay, is this clear? So the types are, you see, first type is foreign body aspiration. Okay, so first type of emergency is foreign body aspiration. Foreign body, you know, something which is not natural to the body, is something which is from outside. So substance which is not natural to the body or place where it is found. Okay, you know, small children, they put peas, they put nuts inside their nose, ears, what not, na? So that is foreign body. Okay, and it causes aspiration when the child put it inside the mouth. Okay, how many of you ate ingested coins? No? Some of you must have eaten coins, and then your mother had to rush to the nearby somebody. So what are the factors responsible for foreign body aspiration? So first is, you know, small children, you know the stages of growth, Erickson's stages and then Freud stages. First is this oral stage. In oral stage 0 to 1 year, so in that stage, children, what they do? Children have a tendency to put everything into their mouths. So that is the oral stage. So what happens? Whatever they find, they put it into their mouth, and as a result, it may be food, it may be anything, but in this age, they cannot control it. Okay, so as it results because of it causes aspiration. Then sometimes eating something and then somebody scolds, and with the food the child cries, and the food tends to cause aspiration. Okay, then or the child is eating a toffee and jumping, or playing, skipping or doing something, then there is aspiration. Okay, so not having molars to chew certain foods adequately. So if you go back to growth and development chapter, you will know that there is a certain age when the molars and premolars develop. Those big teeth, they help us to chew the food nicely, okay, properly, so that it is easier for swallowing. Now these children, if the molars are not developed, then what will happen? If the molars are not developed, the child cannot chew properly and the food pieces are not broken down, and it may cause aspiration. Do you have any question here at this point? Anything?
No, ma'am.
Okay.
No, ma'am.
So if I don't ask you also, if in any slide you have any question, please ask. Okay. So clinical features. Please read out somebody. Clinical features of foreign body aspiration.
Minimal symptoms in small foreign bodies. Upper airway obstruction may cause asphyxia and immediate death. Symptoms may be gagging, choking, wheezing, cyanosis, dyspnea or apnea.
So what is this? What is this? What is this? It is not apnea. What is this? This is aphonia. What is aphonia? Any idea what is aphonia? Anyone knows what is aphonia? What is a means absence of, no? What is phonia? No. Aphonia, what is phonia? Phonia is sound. So from this absence of sound, the child cannot make any sound because of the obstruction with the foreign body. Do you get it? So this is gagging, you know gagging, choking, you know, wheezing, cyanosis, I don't have to explain, but this aphonia, absence of sound, the child cannot make any sound. Okay. Then let us see lower airway obstruction may be tolerated for some time. So it says that if there is obstruction in the lower airway, then what happens? Immediately you may not see symptoms, but then later on symptoms develop, and these are the symptoms. There is wheezing, there is asymmetric or absent breath sound, tachypnea, suprasternal retractions. Then does anyone have this idea what is suprasternal retraction?
No, ma'am.
Okay, you know sternum? Sternum?
Yes, ma'am.
Yes, you must be knowing, you should know what is sternum is. When a child breathes, there is if you open the clothes of the child, yeah. If you open the clothes of the child, you will see that above the sternum there is pulling in of muscle, retraction, understand? When the child is breathing, there is retraction, there is pulling in of the muscle. This occurs when there is obstruction. The next is diagnosis may be done by radiography and fluoroscopy. I don't think there's a... Okay. So, here you are clear. So, diagnosis can be done when a child is presented like that. Diagnosis can be done by radiography, by X-ray and fluoroscopy. Okay. So, how do you manage a case of foreign body aspiration? So, management of a case of foreign body aspiration, if the child is below 1 year, then back slap. Do you know what is back slap? Do you see this picture? Can you see this?
Yes,
The adult is giving that. You see how the child is being held, and the child and the father or whoever it is. Pardon? Anything? Okay, you see the person is giving. You see the hand, no, how it is moved. So this is known as back slap. Okay, this is done for a child who is less than 1 year. Then chest thrust in head down position. Chest thrust in head down position. Head down position means, can you see this? Head is down, and this is known as chest thrust. And here, if the pressure is put here, and then the foreign body may come into the mouth. Do you understand? Okay. Then children above 1 year. So these two, back slap and chest thrust, these are done for children below 1 year, and above 1 year, abdominal thrust. You have heard of this Heimlich's maneuver, I guess. You must have heard about Heimlich's maneuver, and so this is known as Heimlich's maneuver. Can you see? See how the fist is held tight. Then the fist is covered with another hand on above, and pressure is put on the sternum. Do you understand? What is this known as? What did I tell you? What is this known as?
Heimlich maneuver.
Heimlich's maneuver. Okay. Good. So all these things are done when there is foreign body aspiration. Okay. Then, in case of infants, prone position across forearm. So this is the method how it is done. This is the picture. Okay, and this is the explanation of how it is done. Since it is a online class, I don't know how much I can tell you. So prone position, you know what a prone position is, right? So I'll show you. Prone, the child is kept in prone position, okay? And in the whoever is giving care to the child is kept in prone position opposite, and then what it is done? Okay, 5 forceful blows on the back. This is I'm talking about. What is that called? Back slap. Do you understand? I'm talking about back slap. The child is taken in prone position and then 5 forceful slaps are given on the back. If I had a baby here, I could have shown. Sometime later, maybe I can show you, but then for now you see this. So you see the child is kept in prone position and this one forceful slaps are given 5, okay, until the thing is dislodged. Then turn infant keeping head below the trunk. This one. You can see the child is in supine position. The baby is not in prone position now. The child is turned to supine position and then what it is done? The head below the trunk. You can see head below the trunk. Then quick chest thrust. Have you attended class on nails and pals? Nails means neonatal advanced life support. Have you got classes on that? Yes or no? Okay. Okay, if you have not got, okay, understood. So if you have not got, then you will not know much, but okay, you can do one thing for now, after the class is over or when you have lunch break, no, in YouTube, you see, you will understand. Okay? So the child is taken in supine position and with this two finger, can you see? With this two finger in the chest where the sternum is, you know where the sternum is? In the lower third of the sternum, lower part of the sternum, the fingers are kept on the sternum and given thrust. Okay, 1, 2, 3, like this, thrust is given. And this is the other, after giving prone position, the baby is turned and then thrust is given. Okay. Then alternate the actions, and so alternate the actions means once the child has to be kept in this position, give 5 slaps, or the child has to be kept in this position, then give chest thrust. Until the thing object is out, this has to be done. Okay, then extraction can be, if the thing cannot come out this way, then extraction can be done by bronchoscopy. You know what is bronchoscopy under GA. But if this is continuously done and the thing is not coming out, then it may be a danger for the child. So without wasting much time, the child has to be taken to a hospital where emergency care is given, otherwise death may occur. Okay, and very important thing is that to keep small objects out of reach. So you must have done health talk topic on this one. What is that? Health talk topic on prevention of home accidents. Remember, whoever has done. So this is very important. Okay. So clear. Number A was foreign body aspiration. I am talking about all the child emergencies. Okay, so now I am talking about foreign body. Also, first type of emergency was foreign body aspiration. What is the second type? The second type is poisoning. Okay. Yes, somebody please read this out for me.
Poisoning. When cells are injured or destroyed by the inhalation, injection, or absorption of a toxic substance. Factors which determine severity: nature, dose, formulation, and route, nutritional status of the child, age, and other health conditions determine the outcome of poisoning.
Okay. So what is poisoning? Poisoning is something which causes injury to our body and which or destroyed. Okay, which are when cells of the body are injured or destroyed by any object. So the object may be got by inhalation. We may eat it, we may inject it, or we may absorb it. So these are all types of poisonous substances. Okay, and poison is something which causes injury or it destroys or causes death of the cells of natural body cells. Okay, then what are the factors which determine the severity? That means how severe the poison is, who will decide? What are the factors that decide? Okay, so nature of the poison, dose, how much the dose has been taken, then formulation and route. So you understand this. Formulation is what is the formula and which route the child has taken. Then whether the child is nutritionally okay or not. Age of the child and other condition, if there is a comorbidity of the child, then the outcome will not be good. Is there any question in this portion?
No, ma'am.
I hope you understand. Okay, now what are some of the poisonous substances? What is over the counter drugs? Who can tell me?
Ma'am, the drug prescription to get them.
Yes, when you do not get the drug with prescription, it becomes over the counter drugs. So it becomes a poison when you don't know the usage of it and you buy, study and you buy and have it. Okay, so that is over the counter drugs. Next is prescribed medication. Prescribed medication also may be a poison. Why? Now prescribed medication is kept somewhere, child gets it, this is one type of poisoning. Or prescribed medication, when can it become a poison? Any idea? When can a prescribed medication become poison? Mansha?
Yes, ma'am.
Yes. Do you agree that prescribed medication can become poison?
Yes, ma'am.
Yes, because ma'am has put it in the slide. No? Now tell me, how can a prescribed medication become poison?
Ma'am, like if we give prescribed medicine to the children, telling that it's a sweet or candies, then they will think that it's a sweet and candies, and they will try to eat more.
Okay, this also we can occur. What else can occur? What else can occur means, suppose somebody is about has to give the medication, the 1 teaspoon, the child is given 2 teaspoon. Okay, so it becomes a poison, no, because it is more than the prescribed amount. Okay, then this you can see, this is a very beautiful indoor house plant, but it is a very poisonous plant. Okay, so it is also a poison. Then animal and insect bites, we know they are poisonous. Okay, then risk factors. These are the risk factors of poisoning. Okay, so who will read now? Dafira, please read.
Risk factors: inquisitiveness of young children.
Okay, first
Young
explain.
children get high toxicity
Okay, wait, that is okay, but can you
because of small body size.
please listen to me. Can you explain what is inquisitiveness?
They are curious.
Yes, small children are curious. Whatever they find, they put it in their mouth. So this is one of the factor. Next,
Young children get high toxicity because of small body size.
do you understand this? Yes. See, because okay, same medicine. Suppose 500 mg paracetamol is given to an adult, nothing happens. If 500 mg paracetamol is given to a 5-year-old child, something may happen. Why? Because the size of the body is small, so the amount of medication becomes too much for the child, so it becomes a poison. Okay, next.
Peer pressure and risk-taking behavior.
Yes, this generally occur. This peer pressure and risk-taking behavior. This generally occurs in which age group? Yes, my dear students. Why are you sleeping? Okay. This peer pressure and risk-taking behavior, in which age group do you find this?
Ma'am, adolescents.
Very good. Adolescent. You must be going. You must already have gone through the age, no? Huh? It's okay. It's okay. Take little bit. Nothing will happen. है ना? And you don't want to lose friendship. That's why you take ulta pulta things. No? So it becomes a poison. Next is lower socioeconomic status. Lower socioeconomic status in simple terms it is poor people. So poor people what happen? First thing is that they have less food to eat and the children they are hungry, they will eat anything and everything they find anywhere lying around and then if lower socioeconomic status then less rooms will be there, no? Housing you have studied in community. So suppose there are 8-9 members and there are less place to stay, then there will not be proper places where they can keep the medicines and things separately. Do you understand? This is how it may cause poisoning. Okay, so this is general management of poisoning. What is done in case of poisoning? First is initial resuscitation. Immediately, if a case of poisoning comes, then immediately resuscitation is done. And you know what is resuscitation, I suppose? Okay, resuscitation is reviving the child.
Yes, ma'am, we know.
Yeah, reviving. The child is going to die, but reviving the child. Okay, and stabilize. After resuscitating, the child has to be stabilized. Okay, stable. The vitals should be stable. Then poison identification. So, what kind of poison the child has taken? How much is the amount, and how the child has taken? Whether inhalation is there, whether eating is there. So, it has to be find out and then recognize poison syndromes. Okay, so what poison causes what syndrome you have to find out. Prevent further absorption. So the poison is already inside. How to decrease the absorption further and then try to eliminate from the body. And then administration of antibiotics. Why is antibiotic necessary? Because when a poison is entering in the body, then what happens? It causes injury and destruction of the cells. There is ulceration for healing. There may be other infection which may set in. That's why to prevent the infections, the antibiotics are prescribed. Clear? Common types of poisoning.
Yes, ma'am.
Okay. Common type. What are the main types of poisoning that may occur? So, Neha Mili, please read this out for me.
Yes, ma'am. Common types of poisoning. First one is organophosphorus poisoning. Occurs because of commonly found in insecticides and pesticides available at home. Clinical features starts within 30 minutes of ingestion. Features depends on route, amount of exposure. First, there will be bradycardia, hypertension, rhinorrhea, bronchoria, bronchospasm, cough, abdominal cramps, nausea, vomiting, fecal incontinence, blurred vision, increased lacrimation.
Okay, thank you. From this slide, is there any word you do not understand or you want me to explain?
What is bronchoria?
Where bronchoria. Bronchoria means there is a secretion from the bronchus. Means when there is poison enters the body, okay, because poison is not acceptable to the body, so the body starts causing secretion. So there is rhinorrhea from the nose. Water is running nose, na? Running nose occurs. Bronchoria is means bronchoria from the bronchus. That means cough type of mucus will come. Then there is bronchospasm. Do you know what is bronchospasm? The airway, there is spasm of the airway. And if there is bronchospasm, later on it may result in wheezing. Then there is cough. So, okay, from nose it is inside. Do you understand now? Okay. So, organophosphorus poisoning is first type of poisoning and it is found, this compound is found in insecticide and pesticide available at home. Okay, we use no Kala H and then Lakshman Rekha for that cockroach and all. So all these things contain organophosphorus. Okay, and these are the symptoms. Next, what else? What happens then? Urinary incontinence, hypersalivation, tachypnea, hypertension, weakness, intermediate cramps. Okay, intermediate cramps generally will occur in the abdomen. Okay, and then paralysis, fasciculation, and what is fasciculation? Anybody has heard this term before? Do you know what is convulsion? Why the class is so dumb? So
Seizure.
yeah, so it contraction of muscles, no? So fasciculation means small bundles of muscle they try to contract and cause some contraction. That is known as fasciculation, not the whole body. Okay, somewhere in small area there will be movement under the skin. There will be contraction of muscles. Do you get it? Next is altered sensorium. There should not be a comma here, by mistake it is there. So altered sensorium means the child cannot respond to time, place and person. Okay, there is consciousness, there will be a problem in consciousness. Then anxiety, then restlessness, then insomnia, ataxia. Do you know what is ataxia? Yes, my dear. You know or you do not know?
Ma'am, it's inability to maintain a posture.
Yeah, and inability to walk in straight line. Okay, cannot maintain posture, cannot walk properly. Okay, then restlessness, absent reflexes. You know what is absent reflexes? You know reflexes, no, in neurology. So when you try to elicit a reflex, it will not come. So reflexes are absent. Then respiratory paralysis and coma. This occurs when there is too much of poisoning. Early interference was not done. Okay. Then what diagnosis is done? ECG is done, blood count is taken, chest X-ray, then reduced serum cholinesterase level. This is an enzyme, and it is reduced. Okay, when there is a reduced, this is reduced in the blood. It suggests of poisoning, organophosphorus poisoning. Fine. Then what to do? Treatment is decontamination. So you have to take out that poison. And what is the antidote? That means the poison is already inside. You have to give something that will neutralize the poison. So there is atropine is given. Atropine is given. Why? Because it helps in reversing CNS effect. CNS means central nervous system. You have seen that there is absent reflexes, then there is altered sensorium. So all those symptoms are because of CNS involvement. So atropine helps in CNS reversal, and also it helps in preventing or decreasing the secretion. Do you remember the secretion is occurring everywhere? Here, rhinorrhea, bronchoria, no, then increased lacrimation. So hypersalivation. So there is so many things, secretion, no? So atropine helps in decreasing the secretions. Okay. Next is preladoxim. What it is, a cholinesterase activator for patient, and this is given because in blood the level of that cholinesterase it decreases. That is why this medication is given to increase it and to prevent respiratory paralysis, or if a patient already has respiratory paralysis, for the patient to revive from it. Okay, but it is helpful, it is useful only if it is used early. Okay, is this clear?
Yes, ma'am.
Okay. So next week I will continue with another type of poisoning. For now the class is over. Okay? Okay. Thank you.
Thank you, ma'am. Okay, ma'am.